Hello everybody and welcome to the third webinar of the Sports Medicine webinar series hosted by the New England Baptist Hospital. We're very excited, very happy to have you join us today. The agenda for today, we're going to have a 20-minute presentation by Dr. Jeff Zilberfarb, and that's going to be followed by a 10-minute Q&A. So feel free to send your questions via chat that you will find on the right-hand side of your screen. We'll be collecting the questions throughout the talk, and we'll have, as I said, a 10-minute Q&A with the physician and answer as many questions as possible during that time. For those of you who are not familiar with the New England Baptist Hospital, we are a specialty hospital. We're actually the only hospital in the New England area that specializes exclusively in orthopedics. We have the largest volume of orthopedic cases in the state of Massachusetts, and that gives us a knowledge and a unique level of expertise that we want to share with you throughout this webinar series. We hope that you come away with good information about injury prevention, sports-related injury preventions, and also you have a good understanding of treatment options if you happen to be injured. The topic for today is very exciting because of the weather changes is winter fitness. All the winter athletes should know to stay safe and active through the cold season. And as I said earlier, we're very lucky, very happy to have with us Dr. Jeff Zilberfarb. Dr. Zilberfarb is an orthopedic surgeon at the New England Baptist Hospital, and in addition to that, he holds an academic appointment at Harvard Medical School. He received his medical degree from the University of Virginia and completed a general surgery internship and an orthopedic residency at the Naval Hospital in San Diego. Following his residency, he spent 2 years caring for Marines at Camp Lejeune Naval Hospital, where he was promoted to lieutenant commander. After he completed his naval obligation, Dr. Zilberfarb was awarded the Rowe Shoulder Fellowship at Massachusetts General Hospital. He specializes in minimally invasive shoulder, knee, and ankle surgery, as well as total shoulder replacement surgery, and he's also obviously an avid skier. So without further ado, here's Dr. Jeff Zilberfarb.
Thank you, Inez. As the weather's getting cold now is the best time to start preparing for winter sports. So on this talk, we're going to talk about common upper and lower extremity injuries that we often see during winter sports. I'm also going to talk on a couple other things that are relevant to being outside in the cold, such as hypothermia and frostbite.
So how many injuries do we have from winter sports? Well, there's a lot. In 2010, the American Academy of Orthopedic Surgeons said there were approximately 410,000 injuries, a little bit more it's snowboarding, 148,000, and slightly less with skiing. And many of these happen at the end of the day when people are tired. So what can we do to help prevent these injuries? Well, there's several things. First, get into shape. And we'll talk about some things you can do for that. Wear proper protective gear for whatever sport you're doing. Know what you're getting into. Know your capabilities. Don't try to exceed your capabilities. Go into possibly terrain that you're not familiar with, for example. And I think it's helpful to take lessons. So for whatever sport you're trying to do, snowboarding, skiing, etc., working with a pro can help you with your technique, and this can also help minimize injuries. So what can we do to get into shape to play? A couple main things: aerobic things and strengthening and agility. So aerobic things, I'm talking about getting your heart rate up, getting your cardiovascular system ready for these activities, which can be quite demanding in the wintertime when it's cold outside. Start slowly, increase over several weeks. You want to think about intensity and duration. So you want to think about getting your heart rate up, but also think about doing these activities, such as biking or running or swimming, whatever you like to do, over longer and longer periods of time. If you're out of shape, maybe start for 15 minutes, 2 or 3 days a week. Eventually try to build up to 30 to 45 minutes of aerobic activities. Strengthening and agility, we're talking about doing things with weights, things like squats and lunges for your legs, weights for your upper body, working on your core, things like Pilates and yoga and planks are quite good. Basically, you're trying to move, to replicate the activity that you're trying to do before you do it. And now's a good time to do that when we have a few weeks to get ready for these activities. So what kind of things can you do? Well, this is a good exercise. There's a lot of these things that are on the internet. You can just look up dynamic exercises or getting ready for skiing or core strengthening. Here's one that is very simple to do without any special equipment. You can see this guy is just basically jumping from side to side, again trying to replicate the ski motion. Here's another simple one you can do if you have access to a gym. You can see how this young lady is getting in a ski position, squatting down, using these rubber implements under her feet to try to move side to side for balance and strength and core conditioning. These are very simple things you can do at home even. Here's a simple thing you can do at home or a gym. On the left, you see this gentleman leaning against the wall. He's going to be going up and down sort of about halfway, so his knees are about a 90-degree angle. Again, trying to strengthen the lower back, the upper thighs, the knees. The guy on the right's doing push-ups or planks, again working on the core. Proper preparation, what do I mean by that? There are several things. Think about safety, again, what you're getting into. If you don't have the ability to ski off a cliff, then it's not a good idea to do that. Think about food and water if you're out doing a winter hike, because you're going to burn up a lot of calories, you're going to lose a lot of water through dehydration. Take your medications with you that you might need if you're going to be going out on an extended trip. Think about proper clothing to prevent things like hypothermia. Think about your gear. So for snowboarding, skiing, these types of sports, have the proper gear. Have a professional take a look at your bindings, make sure they release properly. And then again, thinking about professional help, taking lessons, for example. So let's talk about some of these ski injuries. We'll go through a few common winter sports and some of the common injuries. So we'll start with skiing. We'll talk about some head and neck injuries, shoulder dislocations and fractures, something called skier's thumb, knee. We've all heard about the torn ACL, meniscus injuries, and things like tibia fractures. So head injuries, the most important thing we can all do is wear a helmet. So it's interesting. I've skied now for probably 30 years, and when I first started skiing, no one wore a helmet. Now, the vast majority of people seem to wear helmets, and I think that's good. Now, head injuries can be decreased, but they cannot be eliminated with a helmet. I think that's the key message. So we don't want to get a false sense of security to think that if we're putting a helmet on, that we can ski aggressively, ski out of control. I mean, certainly, helmets are best for preventing low-speed injuries, things less than, say, 13, 14 miles an hour. Simple falls, but if somebody's skiing really fast down a slope and they hit a tree, the helmet's going to be worthless. And sometimes people ask me, will a helmet prevent a neck injury? Well, no, it does not. It really will not prevent a neck injury. And again, our necks, if you hit a tree very hard or fall down directly on top of your head at a high rate of speed, you're likely to suffer a severe neck injury. Shoulder dislocations are very common ski injuries. I take care of a lot of them, unfortunately, every winter. And what typically happens is, as shown in this skier here, somebody falls and lands directly on the shoulder. And usually the arm is out away from the body, what we call externally rotated and abducted. So kind of like you're throwing a ball, that type of thing. And it typically will pop out the front of the shoulder. So we can see on this picture on the left here, this gentleman, his right shoulder looks asymmetric compared to the nice smooth contours of his left shoulder. This is a dislocated shoulder. The arm bone is actually down here. This young lady playing basketball, you can see there's some deformity here of her left shoulder compared to the right shoulder. She's got a dislocated shoulder. What does that look like on x-ray? Well, here in the x-ray on the left, you can see here's the arm bone, what's called the humerus. This round part is the head of the humerus. Here's the socket, and you can see that this arm bone is not where it's supposed to be. This is dislocated out the front of the shoulder, which is the most common type of ski injury. Again, here's another x-ray showing that. So typically these things are seen at a ski clinic. Typically patients are brought in by a sled, and then typically they're, usually they get some IV sedation to make them a little sleepy. Sometimes we numb up their shoulders with some Novocaine, and then basically there's several ways to put this back in place. This is a very common way where basically one guy pulls this way and one guy pulls that way. It pops into place, and you feel much better immediately. So what happens after that? Well, It depends on a lot of different things. It depends on the age of the patient. It depends on whether you're right-handed or left-handed, which shoulder was dislocated. Depends on what type of activities one does. If they're sedentary, if they don't do a lot of sports, versus somebody who likes to climb rocks and throw a ball, that type of thing. And probably the most common thing is whether or not the ligaments around the shoulder are stretched or they're torn. Typically, if the ligaments are torn, patient's going to require surgery. If they're stretched, many times people can get better without surgery doing a physical therapy program. And we do things like MRI sometimes to help us figure that out. So this is a discussion you have to have with your orthopedic surgeon. So let's move on to another common injury called the skier's thumb. And you may have heard of this by another name called the gamekeeper's thumb, although that's a little bit older name because it actually came from Scotland when, back in the early 1900s, these gamekeepers, people who were taking care of pheasants, would actually grab onto the rabbit or the pheasant to break their neck, that type of thing, and causing a lot of stress on this part of the thumb. But what we see with skiing is that skiers will fall down with the thumb, hitting the ice or the snow, injuring this inner part of the thumb here. And many times these can be treated without surgery. When we examine patients, we see that there's a lot of looseness here if we're pushing on the thumb in this direction. So again, it's this inner part of the thumb. The ligaments are getting stretched out or torn. If the ligaments are stretched out, then many times it can be treated with this little splint device for a few weeks, typically about 6 weeks, without surgery. But if the ligaments are torn, as shown here in this picture, you can see on the outboard side ligament is fine. It's sort of like a rubber band. This one is torn, and in that situation, usually patients will require surgery, and we can often figure that out by our examining patients and also doing things like MRI. So again, you'd have to talk to your orthopedic surgeon about that. So let's move on to another very common sort of sad injury for us, taking care of patients and for patients is a torn anterior cruciate ligament, the dreaded ACL tear. So what happens with this injury? Well, there's been a lot of research looking at skiers, a lot of videos to see how people tear their ACL. A lot of patients sort of tell us what happens. Many times people say, well, I caught an edge and I fell and I twisted my knee. So in Vermont, there's an organization through the University of Vermont that's been studying this for at least 30 years, and a guy by the name of Dr. Johnson's done a lot of work on this. And what he's done is look at this mechanism, and what typically happens, he's coined this term called the phantom foot, and what this means is that the left foot, as shown in this picture here, is getting stuck on the snow, being twisted. And so many times you'll see people, sort of splayed out in all directions here on the slopes. And if you look at this guy's, left leg, it looks like it's rotated, and he's got a bad injury. So again, this is the dreaded, everything's going every which way. So yard sale is what we call that on the ski slope. Everything's all the equipment's flying every way. He's splayed out in several different directions. So what are we talking about? We're talking about this big ligament in the center of the knee, which sort of holds the knee together, and it keeps the knee from being sloppy, from moving, from this lower part, the tibia, moving away from the thigh. And what's shown here on the right is a torn ACL. And the treatment for that depends really on the patient. Sometimes it can be treated with physical therapy, sometimes with surgery. Again, this is a discussion, depends on activity, age of the patient, these types of things. For example, I took care of a patient last year, who was 18, had never skied before, went skiing for the first time, tore her ACL, didn't do any other sports, didn't want to go back to skiing, and she did very well with physical therapy. So because somebody tears their ACL doesn't necessarily mean they always have to have surgery. Now, many times, the converse of that is if people want to get back to things like high levels of skiing or playing soccer, cutting sports side to side, many times they will have to have surgery. And again, that's a discussion for you to have with your orthopedic surgeon. So how about meniscus tears? What are we talking about here? So for meniscus tears, we're talking about this tissue that is located. There's two little guys they're sort of like shock absorbers that are on the inboard and the outboard side of the knee. So here's the one on the outboard side of the knee called the lateral meniscus, and then there's one on the inboard side of the knee called the medial meniscus. So they act as shock absorbers. They can be injured when somebody has a twisting injury of the knee. And sometimes they can be repaired, as shown in this slide, with sutures. The tear is back here, and we can go in and put sutures in it, and it heals up in a few weeks, and people are fine. Sometimes, as shown in this type of tear, which is really more of a chronic tear, something that's been there probably for several months, is the meniscus, and can be sort of in several different positions or pieces. And right now we don't really have great techniques to repair that. So typically in this situation, we'll remove the torn part, leaving the normal meniscus behind, and after a few weeks, people are back to all their activities. So how about the tibia? You can see this is kind of an interesting slide because it's showing a ski boot, and underneath that ski boot is somebody who's already had a fracture of the tibia. And the reason I put this in here is because it shows that typically things like ankle fractures are pretty rare with the ski boots that we have these days. But just above the top of the ski boot, which is right here, there's a lot of stress on the bone. So if somebody has a really bad high velocity fall, they can break their tibia. And many times that can be treated without surgery, but sometimes, as shown in this case, they'll need to have screws and plates and that type of thing to get that to heal. So let's move on to hockey injuries. You can see, this is not a good situation as shown here. This guy is going to end up with some type of injury to his face. So like face injuries, dental injuries, eye injuries, happen quite frequently in hockey. The modern helmet with the face guard can prevent some of these. So let's talk a little bit about what happens. The shoulder AC separations, we've already talked about shoulder dislocations. Knee, ACL, meniscus, these are common injuries. Again, we've already talked about that. Things like the quadriceps and hamstrings can be strain and ankle fractures. So now, what's an AC separation? So an AC separation is not the same as a dislocation. So an AC separation is where the collarbone gets pushed up to the top here. So this is a great X-ray showing the collarbone, which is supposed to be down here, which is not in the right spot. So that collarbone is supposed to be right there. So that's a separated shoulder. So you can see the main shoulder joint is fine. The ball and socket are fine. So it's not a dislocation of the main shoulder joint. It's a separation of the AC, the acromioclavicular joint. And many times, if they're severe, they'll need surgery. If they're not, they actually don't need surgery if the bones are lined up properly. Let's move on to some snowboarding injuries. So in general, with snowboarding, we're going to see a lot more upper extremity or arm injuries than we are with leg injuries. The reason for that is because with the snowboard, the legs are clamped into the board. So they're not independent like with the skis. So they really cannot sort of rotate separately, with the board here. So when people fall, they typically will land on their upper extremities. They'll get things like elbow dislocations. So as shown on the slide on the left, this young lady is falling onto her right arm, and there's a lot of stress on the elbow, and that can lead to what's shown on this X-ray, which is where the bones in the forearm are dislocated from the upper arm bone. So that's something that we can see quite frequently with snowboarding, and many times that will heal. We just sort of, again, give the patient some medication to make them sleepy, numb up the elbow, and we just kind of pull on it in the emergency room, and that will pop it back into place, and they'll be fine. Now, the other thing obviously that can happen if you fall on your arm is to injure the wrist. And what's shown in this picture here is a gentleman who has landed on his left arm and has broken the bones here in the wrist. Two bones, main bones in the forearm, the radius and the ulna. And what's happened here is he's broken the bone in the radius. And you can see on this X-ray that the radius, this bone right here, is not where it's supposed to be, down here. So that's an obvious deformity. It's easy to see with somebody without an X-ray, and there's a name to it you may have heard called a Colles fracture. And many times that can be treated with pulling on the arm. Again, we give the patient some medication to make them sleepy. We numb up the arm in the emergency room or the ski clinic, and we basically put some weights and pull on the arm to straighten it out and put a cast on, and people are fine. Sometimes they'll need a little pin to hold things into place, or sometimes they'll need a plate like which is shown here to hold the bones into place. That heals up in a few weeks. You do some physical therapy and you'll be fine. Let's move on to ice skating injuries. So again, we've talked a bit about, you can imagine if you fall while ice skating, you can break your wrist, you can dislocate your shoulder. We've talked about some of those things. You can tear your ACL and meniscus. So I'm not going to review that again. Let's talk a little bit about ankle fractures. If you fall and twist your ankle, you can certainly cause a fracture, which is shown here. So there are several bones in the ankle, two main ones here, the tibia and the fibula, this one here called the talus. But the most common injuries from ankle fractures are in the fibula, sometimes this part of the tibia over here. And all these different combinations can occur. You can see if you twist the heel out this way, you can put a lot of stress on the bones here and here. Same thing if you twist the heel this way, there can be stress in the opposite direction. So basically, any of these types of combinations of broken bones can happen depending on the position of the foot and how the foot's rotated. And many times, if the bones are lined up properly, without being what we call displaced, if they're in a good position, you can treat these without surgery. We put people in a splint and then a cast for a few weeks and it heals up and people are okay. You can see, however, on this x-ray that the bone here is displaced, here on the fibula also. There's no way that that's going to heal up properly. So we take those people to the operating room, we straighten everything out while they're asleep, put a plate on over here on the fibula, put a screw over here on the tibia. That heals up in a few weeks, and physical therapy, and you're fine. You're back out doing what you want to do. Let's talk a little bit about sledding injuries just for a second. I don't really have any specific things to say other than if you're sledding and you leave the air and you fall in an improper position, you're going to hurt yourself. So don't do that. But kids will be kids, and just be careful. You clear the area for the kids. You make sure there's no big tree stumps, cars in the way, that type of thing, and usually they'll be okay. Now, snowmobile injuries, these are often devastating injuries because the high rate of speed. Folks are flying around out in the backwoods at 30 miles an hour. I would say head and neck injuries unfortunately can occur. Anything can be fractured. You fall off this sled at 30 miles an hour, or you hit somebody else. This is something that I wasn't aware of. I grew up in Virginia where we don't have snowmobiling, but when I first came here and I heard about people trying to take their sleds and sort of fly across these open bodies of water, I thought that was the craziest thing I'd ever heard of. And it is. People drown, unfortunately, from doing this, so this is not something that anybody would ever want to try to do. Let's talk a little bit about what happens at high altitude. And here in the Northeast, we're not really going to see these problems with our mountains necessarily, but I'm talking more about going out to the Alps or in Europe. I'm sorry, going out to Europe and the Alps, or out in the West here in the Rockies, where you start getting up around 8, 10, 12,000 feet. You can start having these high altitude problems. So the first one I'll talk about a little bit has an acronym called HACE, H-A-C-E, which stands for high altitude cerebral edema. So this is going to affect the brain. The second is called HAPE, so high altitude pulmonary edema. So this is going to affect the lungs. So what's going on here? So with HACE, you actually get brain swelling. So you can imagine that's not a good thing. This can be life-threatening. And the symptoms of this are going to be someone who's at high altitude, usually in the first day or two. They're not acclimatized. And let's say they're up at 10,000 feet and they start getting confused, lethargic, have trouble with balance. That's the ataxia. The treatment for this is to come down as soon as possible, not necessarily to ground, but to come down to a lower level. So even coming down, if you're up at 10,000 feet, coming down to 6,000 feet will be very helpful for treating this. But this is something that we all need to be aware of if we're going to be at high altitudes. This HAPE thing, H-A-P-E, this is fluid in the lungs. So this is going to cause shortness of breath, trouble breathing, coughing, when it gets really terrible, gurgling. And again, this can be life-threatening. And you can give people oxygen, but the treatment is you have to bring people down. So that's what's done. How do you prevent these things? Well, the standard recommendation is to don't drink a lot of alcohol. We all know that alcohol can dehydrate people. One of the things that can cause this is dehydration. Some people feel this medication called Diamox can be helpful, so you can talk to your doctor about that. That medication will help decrease bicarbonate, so by doing that, it will increase stimulation for breathing, particularly at nighttime. Ascend slowly. This is the easiest thing that we can do when we're trying to prevent these problems. So, for example, the classic thing is you don't want to fly from Boston to someplace in Europe and the first day go out and ski all day at 12,000 feet. So you have to think about over a couple days doing a slow acclimatation, drinking lots of water. There's a saying that you want to, if you're going to hike or ski high, you want to sleep low. So what that means is that if you're going to be up at 10, 12,000 feet, you want to sleep at a lower level. So that night, you need to be thinking about sleeping. And most of the ski resorts are like this. You're going to be sleeping at 6,000 feet, that type of thing. So that can be very helpful. And again, if you have these symptoms, you need to recognize it and recognize it in your partners. Particularly because if you have these symptoms, you may not recognize yourself that you're getting sick with either HACE or HAPE. So it behooves us to think about these things with the people we're traveling with, and if we notice these symptoms, to get them down immediately. Now, how about things like frostbite, hypothermia? The reason I put this up is to think that these things can occur anywhere. You don't have to be at places like Mount Everest to have either one of these things happen. Obviously, this guy, we all know, Jack Nicholson, we don't want to look like this. So, we need to think about proper clothing. We need to think about keeping dry. So things like hypothermia, will be more common if you get wet. So, even if it's 35 degrees, it could be above freezing, 40 degrees. If you're outside for a long time and you get wet, you can have hypothermia. Now, how about frostbite? Now, this is something that we don't want to see in any of our traveling companions. So, you see this young lady has a black nose, has blisters on her cheeks. You need to cover all exposed surface. If it's below freezing, you need to wear some type of face mask, goggles, hat. It's very easy to get frostbite in an exposed surface, and one of the first things that you'll see is if somebody's we've all had this, our fingers start to get numb and tingly, our toes get numb and tingly. You might look at one of your ski partners and notice that part of their face is turning white. That's the beginning of frostbite. That's our body's way of letting us know that. So you need to cover up all exposed surfaces. Avoid alcohol. Alcohol is a vasodilator, which means that it makes our blood vessels in our hands and arms and legs get distended, which will allow the blood to get closer to the skin and to get cooler faster. So you want to avoid drinking a lot of alcohol if you're going to be outside in the cold. Avoid smoking. Again, same kind of idea. Sort of opposite sort of thing where it can be vasoconstrictor, which again can make our skin liable for frostbite. Don't go outside when it's extremely cold. I mean, I don't ski when it's below 50 and windy. I mean, I think you have to be very cognizant about the conditions. Check the weather report. When you wake up in the morning, what's it going to be like? Most of the times here in New England, we're going to be fine. But there are days, when we get the wind blowing, 40, 50 miles an hour. It's 5 below. Just don't go outside. Take that day off. Do something else. Go hot tubbing. Avoid rubbing the skin. People try to do that, but the skin can be damaged by doing that. The treatment is really getting warm, so get folks inside as quickly as possible to warm up the area so we don't lose any tissue. What's hypothermia? So the medical definition of hypothermia is one's core body temperature is less than 95 degrees. We all live at about 98 degrees. So how can you prevent that? Well, you need to eat, and the reason for that is because out in the cold, our energy requirements are much higher than normal. So we burn a lot of calories to stay warm. We have this furnace in our body, so you need to eat a lot more calories than you would normally eat to stay warm. You need to wear the proper clothing. Fortunately now, the clothing is so amazing, compared to 30, 40 years ago, that we have this clothing that will, wick away moisture. We can do lots of layers, that type of thing. And remove wet clothes. If you get wet, you need to get rid of those clothes so you don't get cold and wet. Think about the symptoms: shivering, disorientation, slow pulse, vasodilation. What I'm talking about here. So, shivering is very common. We all know we shiver when we get cold. Well, what happens if you get less than 95 degrees? Actually, shivering may stop. So, when people get really sick and they get really hypothermic to the point where we're worried about them surviving, they're going to get disoriented, their pulse is going to slow, they're actually going to stop shivering. And in some cases, people have been found out in the snow, dead from hypothermia. They've taken off all the clothes, and you wonder, well, what the heck's going on? Why would somebody do that? It's because in the final stages of hypothermia, we get this vasodilation where the blood vessels get very large, and people feel like they're warm, that they're too hot, but they're not. So treatment, move to a warm area. We can rewarm with hot packs and IV fluids. Let's talk a little bit about snow blindness. So this young lady unfortunately has a patch over her eye because she was out in the snow and out for all day. And later that night, the next day, she felt like she had a rock in her eye, and she had an injury to her cornea. So why does that happen? In snow versus why is it much more common in snow than on a normal day? Well, the reason for that is because snow acts like a great reflector for sunlight, as you know. So on a day like shown in this upper left here, you're outside cutting the grass, and maybe 1% of the sun's rays are going to bounce off the grass. You come down here, where you're outside in the snow, about 80% of the ultraviolet radiation can be reflected up, can bounce up like a mirror into your eye. And what happens is that the front part of the eye, what they're showing here, the cornea, is very sensitive to sunlight. And different types of ultraviolet rays can be absorbed by the cornea and cause basically burning of the cornea, damage to the cornea. So it's easy to prevent this by wearing proper sunglasses. So if you're going to be outside, you need to wear sunglasses. Pretty much all the sunglasses today will provide UV protection. You just have to look at it and say, protects against ultraviolet radiation. If you do that, you're going to be fine. And that's it. So thank you very much for your attention. I love winter sports, and I hope that we've talked about a few things today to help you get through the season. Again, my main focus would be, let's get ready now. You have a few weeks. Do some things. Get ready in the gym or outside, and think about what you're doing when you go out, and you're going to have a great winter season. Thank you.
Thank you, Dr. Zilberfarb. That was great information. We do have a few questions from the audience. The first one, someone wants to know if the wrist guards actually prevent wrist injuries.
Well, certainly they can help. They can help prevent against minor injuries such as wrist sprains. And I do recommend them for activities such as snowboarding, where there's a lot of upper extremity injuries due to falling. Unfortunately, there's no wrist guard made that will 100% protect against an injury. If you hit the snow with enough force, you could certainly break your wrist. But I do, again, recommend them because I think they're helpful for some of the other more minor injuries.
Thank you very much. The other question, someone wants to know if there's a long-term damage from dislocated shoulder, and if there's anything that can be done or should be done when the shoulder is being put back that would prevent those long-term consequences.
Well, the first thing would be to see an orthopedic surgeon, because we have the best expertise for trying to determine the best treatment for your dislocated shoulder. In general, we don't want people to have repeated dislocations, because when the shoulder pops out of place, you can imagine that can cause damage to the structures inside the shoulder, such as the labrum, piece of cartilage in the shoulder, rotator cuff. So our strategy is going to be to minimize or eliminate the recurrence of dislocations. Now, sometimes that can be done with physical therapy. Sometimes that requires surgery. So really the best idea is to see your orthopedic surgeon. You may have to have additional x-rays or even an MRI to make that determination.
So the next question is, I'm interested in returning to the slopes after an ACL surgery. Do I need to wear a brace?
Well, I always tell patients that it's an individual decision, and if the knee is stable, which usually it is after ACL surgery, it's not necessarily required that a patient wear an ACL brace. However, often patients feel more comfortable wearing a brace for the first few times that they go skiing. So I usually tell people to get, we help them to get a relatively inexpensive brace to go out the first few times, see how their knee feels, and then it's up to them to get that confidence back to be able to ski without the brace.
Great, thank you very much. And the last question is, do all meniscal tears require surgery?
Well, no, they don't. Small tears often will heal without surgery. The larger tears often do require surgery. So again, a decision for you to make with your orthopedic surgeon. Often it's based on your physical exam, it's based on the MRI findings. So the bottom line is that no, they don't all require surgery. Some of them will heal.
Well, those are the questions that we had for today. We want to thank you again, Dr. Zilberfarb, for your time, for an excellent talk. We hope everybody was able to get good tips for injury prevention, regardless of the winter sport that you choose, now that the winter is coming.